Hi everyone, my name is Morella and I'm a registered dental hygienist at Ultima Dental. During these unprecedented times of staying at home and self-isolating, oral health is even more important. Now that you aren't able to visit your professional for hygiene, here are some tips and tricks you can use to help maintain optimal oral health. Electric toothbrush versus your manual toothbrush. Which one is better, you ask? Electric toothbrushes are generally designed to do majority of the work for you. As long as you have the correct placement and aren't applying too much pressure onto your teeth when brushing, I think an electric toothbrush is better. Most of these electric toothbrushes come with pressure sensors. This could be indicated by a little vibration, a flashing light, or maybe even a little beeping noise. If you don't have a pressure sensor on your electric toothbrush, you can do two things. You can feel the toothbrush head. If you feel it in your mouth getting slower, it's probably being overworked. Therefore, reducing the pressure is necessary. Or you can listen to the toothbrush. If you hear it get louder, you're probably applying too much pressure. For those of you who are a little bit of an aggressive toothbrusher, I highly suggest you stick with your manual toothbrushes. If you brush with a manual toothbrush regularly, you always want to ensure that you're brushing away from your gum line. So if you're brushing the top, you always want to ensure that you're sweeping downwards. If you're brushing the bottom, you always want to ensure that you're sweeping upwards. Always make sure you're using a soft bristle toothbrush. This can be indicated somewhere on the label or packaging of the brush itself. The tighter your grip on your toothbrush, you're going to apply more pressure. A little tip when I brush my teeth manually is I try to only hold my toothbrush with 2 fingers and my thumb. I ensure that all the motion is in my wrist. While you're brushing your teeth, the only thing that should be moving is your wrist. So if you're cleaning the top, you're brushing downwards. If you're cleaning the bottom, you're brushing upwards. Ideally, we should be brushing our teeth twice a day and flossing once a day. Nighttime is the most important time to brush your teeth. The bacteria in our mouth is most active when we aren't active. If you're somebody who has a tendency of falling asleep before they brush and floss, please feel free shortly after dinner to brush and floss your teeth so that you're going to bed with a clean mouth. Remember, if you eat or drink anything after you've brushed or flossed your teeth, your mouth is not clean anymore. Two great additions to add into your regular hygiene routine to make it better are tongue brushing and an oral mouth rinse. Our tongue houses majority of our mouth's bacteria. The top surface of our tongue where this bacteria collects is called the dorsum. This can be cleaned using a tongue brush or a tongue scraper. Sometimes our manual toothbrush heads may have a tongue brush on the back. Electric toothbrushes sometimes also come with a tongue brush attachment. Tongue brushing should be done once a day and preferably right before bed. If you don't have a tongue brush at home, you can always purchase one at your local drugstore. Oral mouth rinses. Mouthwash is a great addition to your regular hygiene routine. You just want to ensure that there's fluoride in it. Look for the with fluoride indication. Fluoride is what helps us fight cavities. If you're looking for a more natural mouth rinse, you can always use warm water and salt. Take a teaspoon of salt, a warm cup of water, and rinse your mouth thoroughly. Now, if you're somebody who has health risks such as high blood pressure or high cholesterol, I would say sticking to a mouthwash may be a little bit better for you. If you suffer from dry mouth, then maybe using an alcohol-free mouthwash or switching to a Biotene rinse may be what's best for you. Remember, you don't want to replace brushing and flossing with oral mouth rinses. Last but not least, I want to make sure I talk about at-home oral cancer screenings. In the past decade, we've seen a large increase in positive diagnoses of oral cancer. You want to ensure that at least once a week you're taking a look at your mouth, throat, and lymph nodes, especially if you are a smoker. Oral cancer in its early stages has a higher chance of being beat. You can start by checking your tongue. Ensure your hands and fingers are clean. You're going to check the right and left side of your tongue. In a circular massaging motion, you're going to feel your tongue. You're looking for any lumps. Next, you're going to check the roof of your mouth and the floor of your mouth. Make sure you check the inner lining of your cheeks and the back of your throat. If you need to use your phone-like camera, it works perfectly. You also want to make sure that you're checking your lymph nodes. These are located at the front of your ears, along your jawline, along the sides of the neck, and in your collarbone. Use right and left sides as comparisons. If you happen to stumble upon an enlarged lymph node, this could mean that you're either sick or coming down with a cold. If the enlarged lymph node does not go away after at least a few days, I would suggest seeing your health or dental professional in regards to this matter. Remember, if you find anything abnormal or things that just are unusual that you've never seen before, do not hesitate to bring it up to your dental professional. Good oral health leads to better overall health. Be sure to check out Ultima Dental's blog for more information and other at-home tips. If you have a dental emergency, do not hesitate to call. And please, everyone, practice good hand and mouth hygiene and keep physical distancing in mind. Take care for now.